If you've ever sat in the dental chair and noticed your dentist placing a small blue or green sheet around your tooth before starting treatment, you might have wondered, what is this thing? Is it really necessary, and why does my dentist use it? Today I'm going to answer all of that. I'm Dr. Dan from Temple Family Dentistry. By the end of this video, you'll be able to understand exactly what a rubber dam is, why it makes your dental treatment safer, and honestly why you should want your dentist to use one. So let's start with the basics. A rubber dam is a thin, flexible sheet originally made of latex, but most are latex-free, that gets stretched over a small frame and placed in your mouth during certain dental procedures. A small hole is punched in the sheet, which fits snugly around the tooth being treated. This isolates that single tooth from the rest of your mouth, keeping it completely dry and separate from your saliva, your tongue, and everything else going on in there. Here's what it looks like in practice. You can see how the sheet is stretched over the frame. A hole is punched, and a small clip, called a clamp, holds it in place around the tooth. The whole thing takes about a minute or two to place. Or it looks like this. Oh, man. Now here's the part that really matters. Why does this thing exist, and what does it actually do for you as a patient? First, moisture control. Dental materials like fillings and root canal sealers are extremely sensitive to moisture. Even a tiny amount of saliva can compromise a bond or a seal, which could mean the treatment fails sooner than it should. The rubber dam keeps that tooth bone dry, giving your dentist the best possible conditions to work in. Second, infection control. This is especially important during root canal treatment. The whole goal of a root canal is to clean out bacteria from inside the tooth. If saliva, which is full of bacteria, keeps getting into the area, it's working against everything we're trying to do. The rubber dam creates a clean environment, giving treatment the best chance to succeed long term. Third, your safety. During certain procedures, dentists use small instruments, strong rinses, and tiny filling materials. Going back to my video on root canals, you could see the files we use to clean the roots of the teeth were small. Without a rubber dam, there's a real risk of accidentally swallowing or inhaling these things. The dam acts as a physical barrier that protects your airway. As a dentist, that peace of mind is priceless, and it should be for you too. Fourth, better results, faster. With a clean, dry, isolated field, your dentist can actually see what they're doing without constantly stopping to suction or rinse. That means fewer interruptions, better precision, and a quicker appointment for you. Now, I want to be honest with you. Some patients feel a little anxious when they first see a rubber dam. It can feel unfamiliar, and that's completely understandable. But here's what most patients tell me after their first experience with one. It wasn't nearly as bad as they expected. You can breathe normally through your nose, and most people actually breathe better because they're not managing water and suction at the same time. You don't have to hold your mouth open at a perfect angle. You don't have to worry about swallowing anything. A lot of patients find it generally more comfortable once they get used to it. If you have a latex allergy, just let your dentist know. Latex options are widely available, and the only type I personally use. And if the clamp feels a little tight at first, that sensation usually fades within 30 seconds as you settle in. The rubber dam has been used in dentistry since the 1800s. It's not a new trend, it's not an optional extra. It's a well-established standard of care, and research consistently shows that root canals and restorations performed with a rubber dam have better outcomes than those done without one. So if you go to a dentist and they use a rubber dam, that's a good thing. It tells you that they care about doing the procedure right, not just quickly. They're protecting you, and they're giving their work the best chance of lasting. And if you've never seen one before, now you know exactly what it is and why it's there. I'm Dr. Dan. Thank you for watching.